Guys, so today we are going to discuss what are the early warning signs, of mental health issues. So basically, recognizing early warning signs of mental health issues is very crucial, right, for this early intervention as well as support, right? So it's important to note that these signs basically it can vary wildly, depending on the specific mental health condition of that particular person. So some general indicators that may suggest the presence of mental health issues can be, let's say the first one could be changes in mood, right? So what happens here? So here basically one could see that persistent sadness or mood swings, right? There's this increased irritability, right? There's anger or frustration kind of things, right? There's this loss of interest or pleasure in activities which probably that person once enjoyed. They could be the second aspect, which could be changes in behavior. So it's basically withdrawal from social activities, friends or families, right? So there is this significant changes in sleep patterns. There could be insomnia, there could be oversleeping as well, right? There's this noticeable changes in appetite as well as the weight, right, of that particular person. Then comes the physical symptoms, right? So there are this unexplained aches and pains in the body. There are this low energy or fatigue, or even after rest one would feel that, right? So there are this frequent headaches or stomach aches, you can say. Then one more stage is there, probably the cognitive changes, what happens basically. So here there's difficulty in concentrating, making decisions, or even remembering things, right? There's this pervasive feelings of guilt, worthlessness, or let's say even hopelessness as well. There could be this intrusive thoughts or difficult to control your thoughts as well. Then comes the emotional changes. So what happens here? Emotional changes, right? So basically there's this intense fear or worry that disrupt your daily life, right? There's this sudden and overwhelming feelings of panic as well as anxiety and things like that. You could also, kind of feel this rapid or extreme mood changes as well. There could be another kind of changes, which is the changes in performance, right? So here you could see that there's this decline in academic or work performance. You would find difficulty in competing, or let's say completing your task as well, or meeting any kind of deadlines as well, right? There's this neglect of your personal responsibilities. What is social withdrawal, right? So it's basically avoidance of any social situations, or there is this complete isolation as well, right? So there's difficulty in relating to others, or forming, or let's say maintaining any kind of relationship. So there's this loss of interest completely in socializing or engaging in any kind of activities. Even that happens. There's changes in self-care as well. So what does it mean? So basically there's complete negligence of personal hygiene or grooming as well. There's this disinterest in personal appearance or overall well-being. So there also the person lacks basically. There's this lack of motivation to engage in self-care activities, right? So substance abuse, right? So there's this increased use of alcohol, drugs, or other substances as well. So basically this using the substances as a coping mechanism for emotional pain, right? So that becomes very prominent, right? Then there are sleep disturbances as well, wherein the person faces insomnia or difficulty in staying asleep as well. So sleeping excessively or struggling to get out of bed, even that happens, right? So there are this unexplained physical complaints as well, which talks about frequent physical complaints without a clear medical cause, right? So these things are also prominent. People visit to healthcare providers for various physical symptoms as well, right? So that's there. And so what is heightened sensitivity, right? So basically heightened sensitivity is basically to sensory stimuli such as light, sound, or touch as well. So this is increased irritability or distress in response to stimuli. So basically one has to understand that it's important to note that everyone may experience these signs differently, and some individuals may show subtle signs that are not immediately apparent, right? So basically these signs do not necessarily indicate a specific mental health disorder, but may suggest a need for further evaluation by a mental health professional, right? So that's about it. And I think if you or someone is basically experiencing these signs or seeking support from a mental health professional, then I must suggest that you should definitely go and seek that help. Early intervention and appropriate treatment can significantly improve outcomes for individuals dealing with mental health challenges altogether, right? So that's about it in today's video. I hope this really helped you all, and I'm super excited to give you this information on mental health